In this video, we're going to talk about our 8-week lumbar stabilization exercise program. We're going to define lumbar stabilization, and you're going to hear from some of our patients that have been through our lumbar stabilization program. Let's get into the video and take a look. Well, welcome back to another episode of Physio Tips with Marrow. I'm your host, Marrow Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy and the owner of Australian Physiotherapy Specialist Physical Therapy Center here in Jacksonville, Florida. For today's video, we're going to talk about lumbar stabilization exercise. I also want to mention a big thanks to all of our subscribers and all of our watchers, as last week we just hit a landmark of 1,000 subscribers. Thanks so much. We appreciate you guys. We hope you continue to keep watching and hopefully get something out of some of our videos. So back to lumbar stabilization. What is lumbar stabilization? There's deep muscles in the front abdominal area and deep muscles in the back that are called core muscles. The transverse abdominis, the deepest abdominal muscle in the front. It plays a supportive role for our lower back and helps keep us out of back pain. Studies show when your back's been sore for a while, or maybe you've been in bed rest or lying around, maybe due to sickness, your transverse abdominis will become weaker. In the back, we have a muscle called the multifidus. It's a very deep back muscle. It's the deepest. It attaches all the way to the vertebra. It supports the spine against gravity. It protects your discs, and it prevents one vertebra from shifting too much forward on the other vertebra. These muscles are vulnerable to injury. When you're sore, studies show that these muscles will atrophy and get weaker. If you've been in bed rest, studies will show they'll atrophy and get weaker. Signs and symptoms that you may have a lumbar instability would be pain with static postures. Sitting in the car for a long car ride or standing in one place talking to the neighbor begins to aggravate your back. I just want to say, if you're getting something out of this video so far, do us a big favor. Don't forget to hit that like button below, and don't forget to subscribe to our channel to receive more videos like this in the future. All right, let's get back to the video. Well, thanks for being on camera today. So you've been coming to therapy for a few weeks now for your low back pain. Do you mind telling us a little bit about how things are going?
Things are going really well. I feel great. I feel a big improvement. It has helped me so much. You've given me exercises to do at home.
That's great.
Big improvement.
Do you find the exercises difficult to do or pretty easy to do?
Pretty easy.
Now, you had physical therapy in the past for your lower back. Is this a bit different than what you did in the past?
Extremely different.
Okay.
Very different. Wasn't having any relief with other therapies in the past. This has helped immensely. I would come back again and again. I mean, it's made a great improvement in my life.
That's fantastic.
Being able to walk again, do other things in the yard.
Oh, that's great. Okay, great. Well, thank you so much for being on camera, and I'm so glad you're feeling better.
Thank you.
Dr. Carolyn Richardson is a former professor in physiotherapy at the University of Queensland, Australia, and the former leader of the acclaimed research team that introduced the concept of core stability. Professor Carolyn Richardson has been at the forefront of musculoskeletal research for over 30 years. She's published over 100 peer-reviewed papers, 3 physiotherapy textbooks, the inventor of core stability and gravity fitness. I've had the pleasure to study with Dr. Carolyn on 3 different occasions, learn her concepts of how to stabilize the thoracic, the cervical, and the lumbar spine, and we apply that to our patients here every day. Well, thanks for being on video this morning. I want to talk a little bit about your low back pain. So you've been in therapy now approximately 6 weeks, something like that?
Yep.
And what was your back like before therapy?
Well, it was like pretty much just every day, like every second of the day, I would just feel a little pain in the back if I was standing or moving for more than like an hour or so. Start to just be real bad and I need to lay down or sit down.
Okay, and you're a pretty athletic guy. You work out pretty routinely.
Yeah, I lift, and I think I caused the injury lifting.
Okay. And you tried some of the traditional therapy exercises at first. How did that work out?
For a while, didn't really work. I was doing them like your standard stuff, like bridging and all that stuff for a while, and it didn't really seem to help a ton.
Okay. And did you find, so the exercises we did here, they were a bit different than the traditional stuff, right?
Yeah, all upright, weight-bearing exercises, so like squatting and lunging, you know, step up, stuff like that.
That's fantastic. And how's your back doing now at the end of 6 weeks?
Like night and day better. Like instantly, I can pretty much go through my whole day of work, not feel too much pain, and I wake up every day and it doesn't hurt too much. I do these exercises and I instantly feel way better. So night and day better now.
That's so good. I'm so glad to hear your great recovery, and thanks for being on camera.
Yeah, no problem.
In a 2011 Julie Hydes et al. Research study looking at rehabilitation after bed rest, a general strength group was compared to a more specific motor control training group, a la exercises by Dr. Carolyn Richardson. And a focus on the core muscles in the anti-gravity exercise was looked at. Both groups reduced the cross-sectional area loss in the multifidus. However, in the general strength group, the cross-sectional area of the hip flexor muscle, the psoas, was further increased, increasing tightness and dysfunction at the hip flexor. In the motor control training group, the cross-sectional area of the psoas was reduced, decreasing tightness at the hip flexor. This information would implicate that using a more specific stabilization exercise approach would not only help decrease the wasting of the core muscles, but also decrease the tightness at the hip flexors. This exact exercise approach is used for all of our patients here at Australian Physiotherapy Specialist. Well, thanks for being on camera today. So you've been coming to therapy for a few weeks now, about 4 or 5 weeks for your back and leg pain, is that correct?
Absolutely.
Well, if you don't mind, tell us a little bit about how your back and leg was doing before therapy.
Oh, terrible. Crying to get out of the bed.
Oh my goodness. Was it your right leg or your left leg that was bothering you?
My right.
Right leg. And it was kind of like above the knee in the
It
thigh?
was.
Okay. And how long had that been going on?
About 3 weeks.
3 weeks. Okay. And then, so you've been coming to therapy. How's everything gone so far after 4 or 5 weeks of therapy?
Great. I was a little skeptical, but absolutely impressed.
Very good. What are some things you can do now versus before were difficult to do?
Have full range of motion, no problem walking, no problem getting out of the bed, no back pinch, no pain.
That's fantastic. So you did have some high levels of pain, and now the pain's starting to go away,
yeah,
huh?
it's done. I'm good.
That's fantastic. Well, we're so glad you're feeling better, and thanks so much for being on camera.
Absolutely.
Well, thanks for tuning in to today's episode on lumbar stabilization. I hope you got something out of it. If you have some friends or loved ones that have some low back pain, feel free to share the video. And remember, you can always subscribe to our channel to receive more videos like this in the future on physical therapy related tips. We'd love to hear your comments. Let us know if there's any particular topics you want us to do a video on. We'll be glad to take that into consideration. Well, it's goodbye for now, and we'll see you next time on Physio Tips with Marrow.